ॐ धं धन्वन्तरे नमः। कर्पूरगौरं करुणावतारं संसारसारं भुजगेन्द्रहारं सदा वसन्तं हृदयारविन्दे भवं भवानी सहितं नमामि। Ayurveda medicine in the management of Gridhrasi Roga with special reference to sciatica syndrome. Gridhrasi Roga is a type of Vata Jananatmaja Vyadhi. There are 80 types of Vata Jananatmaja Rogas explained in classical texts. Due to altered lifestyle and faulty dietary habit, non-communicable disorders are on the rise on the high are in high incidence. Especially due to heavy exercise or weightlifting, Vata gets aggravated and causes Gridhrasi Roga. In modern science, this disc herniation or prolapse of the lumbar uh, prolapse and lumbar spondylosis, sciatica syndrome is seen. There will be low back ache, pain in lower extremities, maybe one or both, especially on the posterior part of the buttock, radiating to back of the thighs, leg and reaching foot and greater toe. The pain aggravates on exercise or lifting of weight and forward bending. Ayurveda medicine has a bit positive role in the management of sciatica syndrome. पंचकर्म चिकित्सा व्याधि पत्तनिक औषधि प्रयोग प्रत्यापत्या and alteration of dietary habits and lifestyle are advised in the management of Gridhrasi Roga. Introduction. Gridhrasi Roga is a Vatajananatmaja Roga seen commonly in affecting Indian population. There are two types of Gridhrasi mentioned in classical texts, Vataja and Vata Kafaja. Vatavardhaka Ahara Viharas are said to be the causative factors of Gridhrasi Roga. Katishula, pain in waist region, Katigraha, stiffness in low back region, pain in lower limbs, and difficulty in walking. They are the usual clinical features seen in this disease. Lumbar spondylosis and lumbar spondylosis are two common pathologies which leads to this disease. There is another disease as piriformis syndrome that mimics the symptoms of sciatica syndrome. In X-ray or lumbar spine, decrease in intervertebral joints spaces, subchondral sclerosis, and osteophytosis are seen in lumbar spondylosis. There will be varied degree of prolapse and herniation of the disc and ligamental tear are seen in the plain X-ray lumbar spine. Ayurveda medicine has a better role in these disorders. Panchakarma procedures like Katisveda, Mastrabasti, Abhyanga, and Nadisveda are proved beneficial in this disease. Vedanasthabana drugs, Rasayana, Vatahara, Nadivalya, Brahmana, Balya, Poshaka, Ojaskara, and junior drugs are given in the management of Grahani Roga, Gridhrasi Roga. Now let us see the Panchama procedures. Abhyanga, Taira Abhyanga, the Dhanantara Taira Abhyanga or Mahanara Taira Abhyanga can be done. Nadi Sveta and Sarvanga Sveta can also be done. Bhashpa Sveta, Kashaya Basti and Matra Basti. Matra Basti we can give for 10 days. Dhanantara Taira Mahamatra Basti can be given when there is severe symptoms. Single drugs used in this roga are Gugulu, Comifera mucur, Chellaki, Vosella serrata, Bala, Sidacardifolia, Plashina, Allium sativum, Ashwagandha, Zidania somnifera, Gandhaprasarani, Pidiria fetida, Rasna, Pichia lanceolata, Eranda, Piscis communis, Vishamusti, Strychnus naxomica, and Shatavari, Asparagus racemosus. Is a diagrammatic representation. You can see the reddish eh, representation of the pain areas. Here, the sciatic nerve is the longest nerve in the body, starting from the lumbar spine. And it goes, traverses in the posterior area of the of the leg, and it reaches the foot, and it is going towards the great toe. This is the Gugulu. Kamiframukul resin is used as a Vedana Stapana analgesic. Is a Shellaki best Vedana Stapana or shell as an analgesic drug in Ayurveda. Is a gum of Boswellia serrata. Is a Vishamushti. The seeds are purified, processed with Gomutra, and the cover is removed, and it is fried with ghee and made Shodhana. uh, Shuddha, and that's used in the treatment. Other drugs, Durgasanga, Pravala Basma, calx of coral, Mukta Basma, calx of pearls, Pravala Pishti, powder of corals, Mukta Pishti, powder of pearls, Pravala Panchamra Rasa, Mukta Panchamra Rasa, Kamaduga Rasa, Udandi Basma, and Kapatika Basma. Now let us see the formulations. Yogaraja Gulu, Trayodashang Guru, Gukshraja Guru, Shallaki tablets, Mahayogaraja Guru, Balarishta, Ashavandharishta, Pasarani Taila. That's internally also externally also given use. Shadanga Guru, Amritadi Guru, Mahanarayana Taila, Mahamasha Taila, Bala Taila, Panchamana Taila, Vijagarbha Taila, Mahas ವಿಷಗರ್ಭ ತೈಲ, ಪ್ರಭಂಜನ ನಿಮರ್ದನ ತೈಲ, ಧಾನಂತರ ತೈಲ, and Murivena ತೈಲ. Now, if you analyze the ingredients action-wise, following actions are seen. The drugs used in Gridhrasi. They are Vedanastapana, Shotahara, anti-inflammatory, analgesic, Rasayana, Vatahara, Nadivalya, Poshaka, Balya, Brahmana, and Astivardhaka, calcium supplements, Sudhavargya Dravyas, Jivaniya, Ojaskara, Vayastapana, Hemetinic, and Dhatvat. Now let's see the Patyas, wholesome diet enzyme. Milk, Shashikshali and Mudga, Grita Taila, etc. Nutritional diet, Vatahara Ahara Vihara. In obese patients, Kashana Chikitsa has to be followed. Kashana Ahara Vihara is given and adequate rest. Coming to Patyas, unwholesome diet, etc. Excessive exercise, वातकारक आहार विहार, लघु रूक्ष कटु तिक्त कषाय रसयुक्त आहार, weight lifting and traveling. Coming to discussion. Sciatica syndrome involves degenerative changes in the whole sciatic nerve. In a patient, it can occur in one side or both side extremities. Usually, this exercise, weight bearing, weightlifting, forward bending frequently causes this disease. The above activities should be avoided in the treatment of sciatica. Excessive intake of lagu, ruksha, shita, khara, and tikta, katu, kashaya, asayukta, ahara, padarthas should be avoided while treatment. There will be aggravation, vata dosha in the body, hence has to be avoided. Guru kalpas are act as Vedanastapaka. Actually, tests like sitting test, flip test, SLR, regard test, classical sign These are all useful in diagnosing the sciatica syndrome as well as nerve root compression. Vatahara and anti-inflammatory agents. Chalaki is a potent analgesic. Vishamushti acts on spinal nerves as nervine tonic and allergic and alleviates nerve root pain. Oil massage by using various Vatahara oils followed by local fermentation is useful. In cases of severe nerve root compression, sometimes traction is advised. The treatment usually requires for prolonged period, that is 3 to 5 months sometimes, and sometimes more. Sometimes within 15 days, symptoms will subside. Matravasti by using Danandra Taila or Kirabala Taila is beneficial in severe cases. Conditions of malignancy should be diagnosed early and to be referred to surgical treatment sometimes. Isn't it? Sudhavargiya Aushadis Dravyas contain natural calcium useful as calcium supplementation. We have Pravada Pishti, Pravada Basma, Ta Pishti, Mukta Basma, Pravada Panchamarasa, Mukta Panchamarasa. They are all Sudhavargiya Aushadis. So coming to conclusion, sciatica syndrome is a chronic disease. It is caused due to the degeneration of sciatic nerve. Cases of short history usually respond well to Ayurveda treatment. Complete relief is seen in most of the cases of sciatica treated with Ayurveda medicine. Matrabhasti by using Dhanantara Taila or Kshirabala Taila are effective in cases associated with the nerve root pain and in Kati Pradesha and lower limbs. However, a prolonged treatment is necessary in this disease. So today, we have discussed the Ayurveda management of Gridhrasi or sciatica syndrome. So thank you for patient hearing.